Hi, I'm Dr. Rupa Parmar and I'm a private GP here at Midland Health and I'm also the medical director. I've always had an interest for science and medicine. It was my passion from a young age, watching relatives when they went in for procedures or into a hospital. And coupled with my sort of excitement for science, I decided to pursue a career in medicine. Throughout medicine, I've enjoyed women's health and gynecology, and initially wanted to pursue a career in obstetrics and gynecology. But soon realised that actually being a general practitioner with an interest in women's health allowed me to pursue a sort of a wider breadth of women's health, medicine and family planning. So I love being a generalist. Being a GP allows me to see people from all walks of life, all ages, right through from cradle to grave. We see a variety of conditions from mental health to general medicine to allergy, pediatrics, gynecology. And I think it's just that, I suppose, surprise factor and not knowing who's coming through the door and what to expect, but also having knowledge which helps us provide a holistic approach to our patients. So having the knowledge across a variety of specialties can help us often uncover complex medical needs and address sort of areas and concerns which might not be necessarily the reason that the patient's presenting for. I would hope that my patients would think that I'm friendly, approachable, I'm a good listener, but also a good problem solver. I try to be very thorough. I try to not leave any stone unturned, and I try to really provide the best evidence-based medical care that I can do. And to be there, for them to be able to use me as a sounding board, to be approachable, whether that's by email, by phone, face-to-face, videos, whatever it might be. I want them to have that personal relationship with me and to see me as their family doctor and to use me not just for themselves but for the care of their family and loved ones. Working here at Midland Health, the thing I value the most is actually having time with my patients. Having been a doctor in the NHS, I was getting very frustrated with not having the time to listen to my patients, to be able to refer them appropriately into a range of investigations. The luxury of private healthcare allows us to really treat our patients to the best possible care that they require, to the highest quality of clinical standards without long waiting lists and being restricted from certain referrals. So I really love that and I value that for my patients, and hopefully they can see that I'm trying to do my best for them. So at Midland Health, we're able to offer a number of gynecological examinations, from private smear tests to sexual health testing, whether it's an infection, a itch, a rash, a discharge. We can examine you, we can take swabs, we can send off samples and get you tested for any sexually transmitted infection. We also offer a variety of ultrasound scans, whether you're worried about fibroids, cysts, ovarian issues, fertility, heavy periods, we've got you covered. We can offer a scan of that nature to help treat and diagnose your condition. Our gynecologists are also able to offer complex coil removals, cyst removals, hysteroscopies and colposcopies. So if you're worried about any particular gynecology issue, you can book in and see us. We support women going through fertility, through blood testing and other things, but we're here for you, so please do reach out to us. Before you come in for a gynecological examination, things to be aware of. There'll often be a doctor plus a chaperone who'll be in the room. You'll be supported and talked through the whole procedure from start to finish. You'll be given dignity to allow yourself to undress and prepare yourself on the bed. The beds are often gynecology beds, which allow you to have your legs up on the stirrups to make you feel more comfortable, but also to allow the examining doctor a better view and access to the area. Normally the doctor will insert a plastic instrument called a speculum, which is inserted into the vagina and stretches out the vaginal wall so that they can visualise the cervix and the high vaginal area. The doctor is then able to either take the sample, whether that be a smear test, a sexual health test, or just to examine for prolapse and other conditions. Also to actually visualise your cervix. They're also able to insert a coil or remove a cyst once they've inserted the speculum using other instruments. But it's generally a painless procedure, which might be slightly uncomfortable but not painful. As you know, there are gynecology tests that we use to pick up early warning signs of cancer. First one being the smear test. So this is where we take a small sample of cells from the cervix. Every 3 years you'll be invited, and this looks for early warning signs of cancer on the cervix. It also tests for HPV, which is a virus, which if you're positive for, you can have an increased risk of cancer. So these are great tests to pick up, painless tests to pick up early warning signs. We also have a variety of other tests to look for things like ovarian cancer, where you can have a blood test such as a CA125 and an ultrasound scan. And alternatively, we do offer ultrasound scans to look at the lining of the womb, to check for signs of endometrial cancer, and PIPL biopsies, where we take a small sample of tissue from the lining of the womb to check again for abnormalities. So all of these tests are here to really early identify those warning signs of cancer, coupled with obviously symptoms that you might have, such as abnormal bleeding, bleeding after intercourse, bleeding in between your cycle. All of these signs are worrying. So if you're concerned, book in with one of our private GPs or gynecologists. The gynecology examination normally takes between 3 and 5 minutes, depending on what we're looking for. So it allows you enough time to get yourself settled, for the doctor to take any samples, to view the vagina, the cervix, and any other gynecological structures. So it is a relatively quick procedure. If we are doing a contraceptive implant or a coil, then the procedure may take a little bit longer. As with a coil, we have to go through the cervix and introduce the coil into your uterus, so that may take a little bit longer, but no more than 10 minutes, if that. The downtime is very little, as it's a relatively painless procedure. You might experience some bleeding and spotting after a procedure. Some women occasionally get discharge as well, but it is, relatively straightforward and with very little downtime. Myself and a few of the other GPs, we specialise in menopause care. So whether you're experiencing poor sleep, anxiety, low mood, sleep disturbance, low libido, we've got all of the packages for HRT available to you, right through from gels to patches to tablets. We've got the knowledge under one roof. We've also got gynecologists as well that specialise in menopause care. But if you're experiencing those symptoms, do reach out to us, and one of our specialist GPs or myself can assist you in taking a detailed history, a consultation, and prescribing and investigating your symptoms. We've got blood tests at our fingertips that can look at hormone profiles, your testosterone levels, and we can ensure that we get the dose to match your needs and balance your hormones back out again, so that you can be back to your old selves and functioning once again. So yes, we offer menopause health checks as well. So if you're unsure of your symptoms, booking for a menopause health check. And similarly, we can refer for investigations such as bone scanning, as bone density can be an area which is affected during perimenopause and menopause.